fluid accumulation in the lungs and stomach is a concerning medical condition that can significantly impair bodily functions. In the lungs, this condition, known as pulmonary edema, can cause symptoms such as difficulty breathing, a feeling of suffocation, and a cough that may produce frothy sputum, sometimes tinged with blood. When fluid collects in the abdominal cavity, a condition named ascites, it may lead to abdominal discomfort, bloating, and a rapid increase in waist size. Treatment options vary depending on the underlying cause, but often include diuretics to remove excess fluid, lifestyle modifications, and addressing the direct cause, such as heart or liver disease. Risk factors for developing fluid accumulation in these areas include heart failure, severe liver disease, certain infections, and kidney dysfunction, among others. Here are detailed aspects of the disease to expand your understanding of its potential impact and management options. Affected system, pulmonary versus gastrointestinal. The presence of fluid in the lungs, known as pulmonary edema, and in the stomach area, manifesting as ascites, can signal different underlying health issues. Pulmonary edema typically involves the respiratory system and is commonly associated with heart failure, whereas fluid accumulation in the abdominal cavity often points to liver diseases such as cirrhosis or cancer. Rapid breathing, a sense of suffocation, and pink frothy sputum are red flags of pulmonary edema. On the other hand, symptoms like abdominal distension, discomfort, and altered bowel habits suggest ascites. Healthcare providers use imaging, blood tests, and fluid analysis to pinpoint the cause, vital for targeted treatment. Nature of condition, exudative versus secretory. When addressing the presence of fluid in the lungs and stomach, it's important to distinguish whether the fluid accumulation is exudative, denoting a leaky vasculature, where protein-rich fluid seeps out due to inflammation or injury, or secretory, implying active secretion of fluids by glands or tissues. Exudative effusions can indicate conditions like infections, malignancies, or pulmonary emboli, reflecting more serious underlying issues. Conversely, secretory ascites may result from congestive heart failure, liver cirrhosis, or hypoalbuminemia, which leads to an imbalance in osmotic pressures. Identifying the nature, exudative versus secretory, guides the management from targeting the root cause with antimicrobials or anti-inflammatories to supportive treatments like diuretics or therapeutic paracentesis. Typical symptoms: dyspnea, cough versus pain, nausea. When distinguishing between fluid in the lungs, pulmonary edema, and fluid in the stomach, ascites, doctors must consider specific symptoms. Dyspnea, or difficulty breathing, and cough are hallmark signs of pulmonary edema. This condition often arises from heart issues or acute lung injuries, leading to a backup of fluid into the alveolar spaces, giving a sensation of drowning. In contrast, ascites usually manifests with abdominal distension, pain, and nausea. Ascites is frequently linked to liver cirrhosis, where compromised liver function and portal hypertension result in fluid accumulation within the peritoneal cavity. Both conditions can cause significant discomfort and are suggestive of underlying systemic health issues, but pinpointing the exact symptoms is crucial for appropriate treatment. Pathophysiological origin: hydrostatic or inflammatory versus ulceration or overproduction. Fluid accumulation in the lungs and stomach can stem from disparate pathophysiological processes. Hydrostatic causes often relate to cardiac failure, where a compromised heart fails to pump effectively, leading to fluid backup and pulmonary edema. Contrastingly, inflammation due to infections or autoimmune disorders can result in pleural effusions, where the fluid is not blood-derived but inflammatory in nature. In the abdomen, fluid or ascites could result from liver cirrhosis, wherein portal hypertension drives fluid seepage. Conversely, overproduction scenarios involve malignancies, with cancer cells prompting excessive fluid production. Each cause has distinct management strategies, hence accurate diagnosis is crucial for effective treatment. Common etiologies: cardiac dysfunction versus peptic disease. When considering the differential diagnosis for fluid accumulation in the lungs, pulmonary edema, and stomach ascites, two contrasting etiologies emerge: cardiac dysfunction and peptic disease. Cardiac issues, such as congestive heart failure, can disrupt the balance of pressures in the heart and blood vessels, leading to fluid backup into the lungs and abdominal cavity. On the other hand, peptic diseases, including ulcers, can cause ascites through mechanisms like perforation or local inflammation, but are less commonly associated with pulmonary edema. Identifying the underlying cause requires a careful review of symptoms, medical imaging, and sometimes invasive testing to tailor the appropriate management strategy.